Welcome to Vetlec. We are going to study the anatomy of femur of dog. Femur is the largest and heaviest bone of pelvic limb of dogs. Proximally, it forms hip joint with the acetabulum of os coxae, while distally it articulates with tibia and fibula in order to form stifle joint. It has two extremities called proximal extremity and the other is the distal extremity. And between these two extremities, we have a body of femur. First, I am going to discuss the proximal extremity of femur. In the proximal extremity, the most prominent feature is the head of femur, which is smooth and nearly hemisphere. This is the head of femur. So it is smooth and nearly hemisphere, and this head is present on the medial side of femur. This is the cranial view or anterior view of femur bone. This is the medial aspect, and this is the lateral aspect. This is the medial aspect. This whole is the lateral aspect. And this is the caudal view of femur. And here in this picture, here we have medial aspect, and this is the lateral side of femur. So as you can see that head of femur is present at the medial side of femur. This is the medial aspect, this is the medial side. So head is present on the medial side and it is involved in articulation with the acetabulum of os coxae, and in this way it forms hip joint. Now on the caudomedial margin of this head, this is the caudomedial margin, as this is the posterior view or caudal view of femur, and this is the medial view. So this is this depression, a small depression you can see in the picture. This is the caudomedial margin, or this is also the caudomedial margin of head of femur. So on this caudomedial margin of head, a depression is present which is known as fovea capitis femoris. This depression is fovea capitis femoris. Here you can see fovea capitis femoris. So the ligament of head of femur is attached on this fovea capitis femoris. The next feature in the proximal extremity of femur of dog is neck, which joins head with the body. This is the neck and it is joining the head with the body. And this neck is also present on the medial side, as you can see in the picture. This structure is known as greater trochanter, and it is the largest eminence of femur. And as you can see in the picture that this greater trochanter is present on the lateral side of femur. Now on caudal aspect or posterior view of the femur, as you can see, there is a deep cavity which is called trochanteric fossa. This is the trochanteric fossa, this deep cavity. And this trochanteric fossa is present just medial to the greater trochanter, as this is the greater trochanter on the lateral side and this is the intertrochanteric fossa which is present just medial to this greater trochanter. Now after greater trochanter, we have another trochanter which is known as lesser trochanter, and it is present on the medial side. This is the lesser trochanter present on the medial side, and it is a pyramidal projection. So this lesser trochanter is present on medial side and it is a pyramidal projection. Now between these two trochanters, one is the lesser trochanter and other is the greater trochanter. You can see a crest is present. This is a crest which is present between these two trochanters. So this crest is called intertrochanteric crest, and this crest is actually a caudolateral boundary of trochanteric fossa. So this crest acts as a caudolateral boundary of this trochanteric fossa, and it is present between the lesser trochanter and the greater trochanter. Now another poorly developed trochanter is present on the lateral side. This poorly developed trochanter is present on the lateral side, and it is present exactly at the level of lesser trochanter. So here we have lesser trochanter which is present on the medial side, and its level at the lateral side you can see another trochanter which is a poorly developed trochanter, and we call this trochanter as third trochanter. So totally we have three trochanters in the proximal extremity of femur. One is the greater trochanter which is present at the lateral side. Second one is the medial trochanter, lesser trochanter which is present at the medial side. And here we have third trochanter which is also present on the lateral side, but at the same level as the medial trochanter or lesser trochanter. So this small this third trochanter is a small rough area and it is present just distal to the greater trochanter. As you can see in this picture, that this is the greater trochanter and here we have third trochanter. So third trochanter is present just distal to the greater trochanter. Now let's come to the body of femur. So body of femur is slightly convex, smooth and rounded on its cranial side. As you can see in the picture, it is convex, smooth and rounded on cranial side, while caudally the body of femur is rough and it contains two lips, and these are lateral and medial lip. Medial lip and lateral lip. Now, as you can see that we have two lips on the caudal, on the posterior view or caudal surface of femur. You can see here, this is the medial lip and this is the lateral lip. So as you can see in the picture, that the medial lip starts proximally from this lesser trochanter. This is the medial side and this is the lateral side. So here we have medial lip and it starts proximally from this lesser trochanter and ends at a medial supracondylar tuberosity which is present at the distal extremity of femur, and I'll discuss this supracondylar tuberosity in the section of distal extremity. So you can see that it is starting from the lesser trochanter proximally and it ends at supracondylar tuberosity, which is present at the distal extremity. Similarly, if we see the lateral lip, it also starts from the third trochanter proximally, while it ends on the lateral supracondylar tuberosity, which is present distally. So this is the lateral supracondylar tuberosity and this is the medial supracondylar tuberosity. Now let's talk about the distal extremity of femur, which is involved in the formation of stifle joint with tibia and fibula. Trochlea of femur, this is the trochlea. Trochlea of femur is a smooth groove structure for articulation with patella, and patella is present craniodistally on this trochlea. Means patella is present here, craniodistally. So trochlea contains lateral and medial ridge and lateral ridge, where medial ridge is thicker than the lateral one. Here we have medial ridge, this is the medial ridge of trochlea and this is the lateral ridge. So medial ridge is thicker and between these two ridges there is a smooth groove. So this is the trochlea of femur. Patella is a sesamoid bone which is present on the trochlea of femur, and patella is present in the tendon of quadriceps femoris muscle. And it helps to extend the stifle joint so that the patella moves on the trochlea of femur. Trochlea is continuous with the condyles. It's continuous with the condyles, and these condyles are medial condyle and lateral condyle. Here we have medial condyle, this is the medial condyle and this is the lateral condyle. So as you can see in the picture that this trochlea is continuous with both condyles. These both condyles, are about similar in shape and surface, and they both articulate with tibia. Now on caudal side, between both condyles, there is a fossa which is known as intercondylar fossa. This is the intercondylar fossa which is present at the posterior aspect or caudal aspect of femur between both condyles. This fossa is actually the point of attachment for cruciate ligaments, and these ligaments help to stabilize the stifle joint. So this fossa is the point of attachment for cruciate ligaments. Now on caudo-dorsal aspect, as this is the caudal view and this is the dorsal aspect above the condyles, just proximal to condyles. So this is the caudo-dorsal aspect. On this caudo-dorsal aspect, two facets are present. One facet is present here on the lateral side and other facet is present on this medial side. So these are called lateral and medial facets, and these facets provide site for attachment of sesamoid bones called fibula. So on medial facet, medial fibula is present, while on the lateral facet, lateral fibula is present. And I have told you that fibula is a sesamoid bone, and this sesamoid bone is present only in case of dogs, and its position is caudo-dorsal aspect. Now, just proximal to these fabular facets, we have lateral and medial supracondylar tuberosities. Here we have medial supracondylar tuberosity, and here this is the uh, lateral supracondylar tuberosity. This is the lateral supracondylar tuberosity. And between these two supracondylar tuberosities, there is a flat triangular area called popliteal surface. This is the flat triangular area between two supracondylar tuberosities, and it is known as popliteal surface. And this popliteal surface, as you can see in the picture, is present just proximal to these condyles and intercondylar fossa. So I'm repeating that on the medial side we have medial supracondylar tuberosity, and on the lateral side, just proximal to the facet, we have lateral supracondylar tuberosity, and between these two supracondylar tuberosities there is a flat triangular area called popliteal surface, and this popliteal surface is present just proximal to intercondylar fossa and both condyles. Now another structure which is present just proximal to both condyles is the epicondyle. So proximal to the lateral condyle we have lateral epicondyle. This is the lateral epicondyle, you can see this is the lateral epicondyle, and this line you can see this is the medial epicondyle, which is present just proximal to the medial condyle. So here we have lateral epicondyle, and here we have medial epicondyle, and the medial epicondyle is thicker one. Sorry, it is rough. Medial epicondyle is rough as compared to the lateral epicondyle. So I am repeating the distal extremity again. Here we have trochlea surrounded by two ridges. Then we have two condyles, medial condyle and lateral condyle. Proximal to at the cordo-dorsal aspect of both condyles, we have facets where fibula are attached, and fibula is a sesamoid bone which is present only in dogs. Then between both condyles we have intercondylar fossa. Then just proximal to medial condyle we have a medial epicondyle, and proximal to the lateral condyle we have lateral epicondyle. Similarly, just proximal to the lateral condyle we have lateral supracondylar tuberosity, which is present just proximal to the lateral fabular facet, and similarly just proximal to the medial fabular facet we have medial supracondylar tuberosity, and between these two tuberosities we have popliteal surface. So this was all about femur. Thank you.